Hello there, it's Larry Potsabinski again, your friend whose life experience makes me adept at understanding schizophrenia and how to survive with it, and complications from treatment. And I want to frame this one a little bit differently, though, and say this is Big Pharma's little secret. That I've talked about, that side effects of the antipsychotic drug medications being permanent and various. Like the initial one learned of the first medication became available in 1952, and in 1964 they learned about tardive dyskinesia, which means tardive showing up later after you stop taking the drug. Dyskinesia, involuntary movements. So later showing up involuntary movements from taking certain drugs. But the point of this is it's not just antipsychotic drugs that do this for people with schizophrenia and other related illnesses who take those kind of drugs. I found a paper and studied it again today, and I want to read you from all different drug categories that cause tardive dyskinesia. This is like Big Pharma's dirty little secret that so many drug types cause tardive dyskinesia. And there was no treatment for it when this paper was written in 2016, 17, and later by 2018 there were drugs available for it. I'm on one now, and before that I used to get muscle twitches all over my body, just twitching, just jerking. I still get tremors right there. You can see it moving if you got good eyes, I guess, good film. But anyway, so these other drug categories cause this besides the antipsychotic drugs. I didn't know how much total. I didn't count them, but about 10 of them. And the next one is anticholinergic agents are prescribed for chronic obstructive pulmonary disease, COPD, and bladder control, and to decrease symptoms associated with Parkinson's disease. These have shown to worsen the symptoms of tardive dyskinesia and impair cognitive function. That antidepressants are prescribed for depression, anxiety, obsessive compulsive disorder, and attention deficit disorder, and are even useful in treating chronic and neuropathic pain. In general, the mechanism of action of antidepressants is to stabilize levels of. Some of this is not necessary. But tardive dyskinesia induced by antidepressants is less prevalent than tardive dyskinesia induced by antipsychotic drugs. However, antidepressant-induced tardive dyskinesia is commonly in elderly patients who have greater likelihood of other conditions, because older age is associated with changes in absorption, distribution, metabolism, and excretion of medications. Long-term antidepressant exposure may lead to increased medication accumulation and severe side effects. Okay, so there's antidepressant, that's 3, and emetics, which is prescribed for severe nausea and acid reflux, cause this kind of tardive dyskinesia too. Okay, so that's always that 3 or 4. Anticonvulsants are agents prescribed to reduce epileptic seizures and so is implicated in dyskinesias and has been well documented to link to tardive dyskinesia. The drugs for anticonvulsants, antihistamines for simple ordinary allergies. Antihistamines, I saw as early as 7.5 months after treatment initiation associated with with tardive dyskinesia, antihistamines. So there's another one. That's 7 or 6 or 5 or decongestants, primarily used to treat cold and flu symptoms, are primarily composed of pseudoephedrine, phenylephrine, or derivatives of these two medications. These medications are some kind of type chemical, therefore they increase this and that, and so reason to be expected to exacerbate movement disorders and tardive dyskinesia. Decongestants, anti-malarials, anti-malaria medication, and then what do we have? Anti-Parkinson agents used to treat Parkinson's disease, and then we have after that we have anxiolytics. I never heard the word before. It means drugs for anxiety. Include barbiturates, benzodiazepines, carbamates, opioids, and antidepressants, such as whatever those are, generic names are. But so these cause tardive dyskinesia too. Induces incidences account for tardive dyskinesia in individuals who take antioxidants, or whatever this word is. good news is what I'm reading here. Biogenic amines are organic molecules derived from amino acids that are found in nearly all of the foods that we eat. This category of molecule includes monoamines such as histamine, serotonin, norepinephrine, dopamine, and epinephrine. The biogenic amine tyramine is found in aged cheeses, cured meats, pickled and fermented foods, alcohol, and chocolate. Individuals on long-term MAOI type antidepressant treatment for depression need to be cautious when consuming tyramine-rich foods because tyramine is metabolized by MAO, whatever that is. Build up and can lead to the hypertensive crisis. While TD is not directly associated with hypertensive crisis, the stress on the body from hypertensive crisis may be enough to induce further complications in a manner similar to the association between tardive dyskinesia and malarial fever discussed previously. So the mood stabilizers is another category. How many is this? 9 or 10 categories? Mood stabilizers are used to treat bipolar disorder, borderline personality disorder, and schizoaffective disorder. They include lithium, anticonvulsants, and antipsychotic drugs. And while there is an established link between lithium and tardive dyskinesia, the incidence of tardive dyskinesia is much greater when lithium is used in combination with antipsychotic drugs. Okay, so stimulants, both legal and illegal, have been associated with tardive dyskinesia. Stimulants including caffeine, nicotine, guarana, ginseng, legal amphetamines, ephedrine, and illicit amphetamines, methamphetamine. Stimulants act through a variety of mechanisms to increase alertness, energy, and concentration. Caffeine, for example, is some kind of chemical. Caffeine has not been shown to directly cause tardive dyskinesia, but very high doses of caffeine, 1,000 milligrams plus, can exacerbate tardive dyskinesia symptoms. Low doses of caffeine are reported to be effective in reducing dyskinetic and freezing gait movements. So you have good and bad with all this. Well, Dad always said you have to take the good with the bad. So prevention and treatment. Then we're on. So that's So how many categories was that? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 13 different drug categories cause this tardive dyskinesia movement disorder. When you stop taking it, you start shaking and tremor. Your fingers will tremor and move in circles by themselves, and you'll get muscle twitches on you in your cheeks and I don't know what that does to you, but it just makes you not normal. I mean, it's a damage. It's a physical injury caused by these pharmaceutical drugs that you cannot sue for. Big Pharma gets off. So fuck Big Pharma. This is what their little secret is. That all these different drug categories cause tardive dyskinesia. And that's just one form of damage that their drugs can cause. I suspect there are several more that I don't know how to exactly figure out, decipher from my abilities. But so the word for the wise, watch what you take. Listen to that again if you want to hear what it all includes. And that's all true. So thank you and have a nice day. Good day to your life. Thank you all for watching.